Maybe a question which is related to that and which comes from Marie. And David, you will also be able to elaborate on that, but maybe Vincent can start. Are hospitals opening up to sharing the data about patients they have? I guess the situation is different in Europe and in the States. So that's why I think that both of you maybe can give your views, share your views about that.
Yes, sure. So the question is, well, there's no single answer to that. There's a number of hospitals which are more open, or they're less open. One of the big differences between US and Europe is that in the US there's more standardization coming up with FHIR interfaces and meaningful use 3 being imposed to hospitals. While in Europe there are no such initiatives yet, and there is no standard protocol. So the situation is a lot more scattered in Europe, or less compatible. And the mentality of people also, it might be different. US care is private and with private insurance companies, while in Europe there's a lot of social security or national social security. So that means there's different speeds of movement. I would say that the US is changing faster than Europe, and probably patients change doctors more often. So there is a more meaning to open up the data to patients, because they need to take their data to a new doctor. While in Europe, there's maybe a more traditional approach. So those would be some of the main elements I would see. David, what would you say?
Excellent points, Vincent. I would just add that, to add data to what you're saying, it's very clear that Apple and other companies are enabling patients to access their data. So, and as I showed, Andaman7 is also being able to do that. And so with the new meaningful use, as you mentioned, and the FHIR APIs, it's no longer the hospital's decision whether or not the patient has access to the data. It's simply the patient's decision to not only access their data, but also download it, have it where they can then control who they share it with. And that's what Andaman7 allows, and that's what the federal government of the United States wants to have happen, because they know that the slowness or the lack of interoperability of health information exchange is part of the challenge of the high costs and the low outcomes that we're getting here in the States.
Mm-hmm.